Hey everyone, thanks for joining us. This is our first episode of Fantasy Injury Advice with DAP and our special guest, who I'll bring on here in a second. He's in the header, so you kind of know who's going to be. But I want to first off say, hey, go over to fantasysixpack.net and become a subscriber, become a VIP. Please join for a couple of reasons. One, it helps me actually do more of these things, and they send me money, so that's always good. But two, more importantly, right, you get access to our top rank, most accurate ranker according to uh, fantasy metrics, and also you get access to our Discord member chat where we will respond and answer all of your questions. I got questions just last week about who should I start, or can you please look at my roster and breaking it down. So those kind of personal touches that we have over at fantasysixpack.net. So please go on over, subscribe, and without further ado, let's bring on our guest. So Nic Civale, I messed it up. I was so excited. Nic Civale.
A little extra fancy on the end there. That was good.
I was so excited that I wasn't going to mess that up. I even asked you ahead of time. And the thing is, I put a long E at the end of it. And I was like, and then I made it French. I apologize. So Nic, as everybody can kind of tell by your last name, you have a family member that is a starting pitcher. It's Noah Syndergaard. So you and Noah are related. That's pretty amazing. So, congratulations there. You have a lot of insight there. No, seriously. You want to mention your famous family member in baseball, or are we not supposed to?
Sure. Yeah, no, that's all good. Yeah, my brother Aaron, he's pitching with Cleveland. He's been there up a couple years. It makes us proud every time he goes out there. I'm not going to go and comment on how he's doing with his injury, but better every day.
Good.
He can't wait to get back out there. So, it's a joy. It's an honor to watch him out there every time, and he makes us proud every single day.
So I have two questions for that. My first question is he required to be on every one of your fantasy teams?
Yeah. I mean, yeah, it's
okay.
That is a requirement.
I just want to make sure.
A couple orphan teams, and then that's always my first move. And I beg the commissioner, don't let anyone know my last name, because that's just going to drive up the price. So he's on all my teams.
Good. That's the first question I was going to ask you. Second one is, who's a better pitcher? Just be honest with me. I know you're going to probably say you, but just go ahead. Who's the better pitcher?
The last time I was a better pitcher than my brother was, I was 12 and he was 8.5. And although I think I did throw my first no-hitter before he did, but I had 3.5 years on him. No, but he was, I remember very specifically, I was catching in our little league team, and he was 8 years old playing up with the 12-year-olds.
Oh, wow.
They came in, they pitched his first game and struck out like 4 out of 6 guys, and it was just like, yep, he's good.
So was that the first moment you realized your brother's better than you, or did you have a moment before that?
No, I can remember specifically. I came back home from college, and he was pitching against Kent School in Connecticut.
Okay.
And I showed up, and I saw this 12-6 curveball he threw that started at the kid's helmet and landed at his ankles, and I was like,
wow.
He always had a good curveball, but that was like a moment where you're like, oh my goodness, he actually like, this is something for sure.
Sure.
So very cool.
Well, that's awesome. So I don't know if you want to talk about your credentials here, but we're bringing you on here. I'm bringing you on so we can talk injury news and kind of give some, ideas and advice to fantasy players. We want to not just talk about like the latest developments, but kind of talk about, the ways they can understand injuries a little bit better here. But you want to talk a little bit about your background before we kind of delve into the questions so that people understand who they're talking to?
Yeah, for sure. I'm a doctor of physical therapy. Been working for about 5.5 years. And one of the things I like doing most as a physical therapist is trying to get the patient to understand what's going on with them. So having a background in baseball, having this opportunity to talk fantasy sports and give people kind of a little bit of an insight as to what exactly is going on with these injuries, it feels a very comfortable thing for me to do. So I look forward to answering questions on Twitter and trying to get people a little bit more insight as to just exactly what's going on with these injuries.
Well, great. Well, let's delve in. So, the very first question I got for you, super easy. One of our readers sent it in. Why are all the injuries happening, and why are they only affecting players on my teams? So, if you want to just take a minute and just do that one, that'd
That
be great.
that second one, everyone wants to know the answer to that one.
Right.
Yeah, no, there's it could be complete randomness that we're seeing an increase in injuries to the start of
Mhm.
the season. It's the first kind of normal spring training followed by a normal start to the year. So we were kind of hoping this would go in and we'd have fewer injuries. I know a lot of people are speculating on the pitch clock. Is that part of it?
Right.
Um, I can understand how it could possibly lead to more injuries, but based on what MLB has said, their minor league seasons didn't show any spikes in injuries. So my first inkling, which no one really wants to hear, is it's probably just random.
Okay.
There might be a stretch in July and August where it's like, oh, injuries are kind of down relative to April, and who knows why. But I'm sure we'll get into the pitch clock stuff later. But I actually think there's a possibility that that might help pitchers stay warm,
Oh,
and I'm
really?
wondering if it's going to help kind of decrease injuries. That wasn't my first thought. It kind
Really?
of took some circling back around, but um, you're staying warm. Innings are going quicker. Pitchers are not sitting on the bench for as long.
Hmm.
I mean, you only have to sit for 2 or 3 minutes sometimes. You're right back out there. So
Right.
you could look at it both ways, but ultimately we probably need more data and more time to really analyze.
Yeah, so we were talking about this before, when we were prepping that from sporttrack.com, which is a fantastic website, we had looked up that there was 728 IL stints last season. And then according to sporttrack.com, there's already 254. Now, this is 2 days ago. This does not include Robbie Ray and a few other people that have already hit the IL. So 254 already this year. So we haven't even played 25% of your schedule yet. And so this is going to blow past last year's number. Now, you already said that you think, maybe the faster pace of play might actually be helping keep them warm. But any other kind of thoughts about why the increase in injuries? Do you think it's because people aren't following you on Twitter and asking you for advice? Any other thoughts there?
Yeah, no, that could be part of it. You never know. Can't rule it out.
Right.
No, it's really hard to tell at this point why there is an increase in injuries. One thing I'll be curious to see as it gets later in the season is, are these injuries more short term? Are people utilizing their IL slots more liberally, calling up minor league guys because of this new incentive that when the young guys come up and do well, they might get a draft pick or whatever, whatever it is.
Right.
So it's possible that teams are just more willing to bring up the young guys, throw someone on the IL for 15 days or 10 days, even if it could be like 7 or 8 before they come back. Um, so hopefully we can kind of circle back on this around the All-Star break and get a little bit more clarity. But as for now, it's a little bit blurry. It's kind of hard to tell why.
I got to tell you, I am so happy that you're already talking about doing another show. So that just makes me excited. So yeah, we should definitely circle back, and
Yeah.
hopefully they'll, still be paying bills and keeping my lights on. But all right, so let me talk about some other things that kind of always affect me, some terminology that I don't understand, and
Mhm.
maybe some it'll help us some fantasy players out there. So soft tissue injury seems to be a term used a lot, especially a lot more lately. I saw it was something that I heard a lot, obviously, throughout the years, but especially during the shortened pandemic season and even now, it just seems to be kind of a catch all. So, can you explain a little bit more about what that could mean or what that affects and what we're dealing with there?
Yeah, so a soft tissue injury is essentially boiling it down to a category of muscle, tendon, ligament. It's one of those three things.
Okay.
And the reason that teams use that terminology so much is initially you most likely take an x-ray of whatever injury it is. They're quicker, they're cheaper, they're way more accessible compared to MRIs or a CT scan. So when you take your x-ray, it shows you the bone structure and that's about it. It doesn't show you muscle tissue, tendinous tissue, or ligament. So when they rule out any bone injuries, they can say, all right, it's a soft tissue injury. We're going to have to follow up with an MRI to get more details on that. So that's kind of like a preliminary we know it's not a fracture. So we got soft tissue injury from that. But just to recap there, it's either muscle, tendon, or ligament.
Well, that leads me to my next thing. So I'm constantly hearing about tendons and ligaments, right? Strains and sprains.
hmm
Is there a difference? And why do I, when do I use what and what's more worrisome, I guess?
So a strain is going to be 9 times out of 10 related to muscle tissue. Sometimes people will refer to a tendon injury as a strain. Usually that's going to be more of an inflammation type of thing, like a tendonitis. Um, and a sprain is an injury to a ligament. So strain is muscle, tendon, sprain is ligament. In most cases, you're going to get them rated grade 1, 2, or 3.
Okay.
1 is the least, 2 is most of the injuries, somewhere in the middle. 3 is closer to a complete tear,
Oh,
oftentimes requiring surgery. Um, so between the two, it's another one where it kind of depends what muscle you're talking about, what ligament you're talking about. But the first thing you look to is what's the grade.
okay.
Grade 1 is usually a couple weeks. Grade 2 starts getting into talking months, and grade 3 is like good chunk of the season, basically.
So can I figure out grade one, grade two, grade three only through films of some sort, the MRIs or things of that nature? Or is there a way to just kind of understand the injury and kind of sees the swelling and things of that nature and understand kind of grade one, grade two at that point?
Yeah, if you're gonna make a definitive uh, assumption about it, you're gonna want to see the actual film and the images, the radiology, and usually that's provided to us as far as the end result and what they're coming to a conclusion with. But it's extremely hard to kind of predict that before that information becomes public.
Okay.
So you can usually, I would say, if you're a physical therapist watching a game, when nerdy thing to do when I'm watching with any of my friends
Uh huh.
that I went to grad school with, we're like, "Oh, grade 2 hamstring," calling it like lateral tendon. We're always talking, trying to guess, and you could get a pretty good guess, but a lot of times you're actually just looking at the athlete's reaction and just how much agony is in their face,
Okay.
and you go off of that. But no, unless you have the actual imaging, it's really hard to predict if it's grade 1, 2, or 3.
So basically, you're telling me that hanging out with your friends or watching the game with your friends would cause a ton of anxiety for a fantasy
Yeah. Oh,
player.
yeah.
Okay. All right. So
Yeah.
So you're telling me then that, the only way I can really understand some of this stuff is the imaging. So when we see, these news kind of tidbits that come out almost immediately after a player gets hurt, goes back to the locker room and, especially in a visiting locker room, and they're saying, it most likely it's grade one or most likely it's grade two. Really what we're hearing here is just a complete guess or obviously a guess-ish, as you said, right? You can kind of
Mhm.
look to see but really, we should be waiting 48, 72 hours for that film to come out. And again, I keep saying film, and I'm sure it's not film anymore. But
No, it's a
until we
good
see those,
overarching, yeah.
yeah. So really, they should, nobody should make any rash moves at that point from a fantasy player perspective until they, get that imaging done. Is that correct?
Mhm. Yeah, yeah, essentially, that's what it boils down to is you shouldn't be unless you're getting an amazing, like, sell high or buy low situation type of thing. Because 9 times out of 10, people are gonna blow it out of proportion, especially if it looks bad. Like,
Hmm.
if someone goes down hard, they're gonna be like, "Oh, season's over, let me try to sell them."
Right.
If you can
Right.
get one of those, in most cases, it's gonna work out for you as the buyer. But yeah, what you said is pretty accurate. You really can't go off the initial reports. It's generally a pretty educated guess by the athletic trainer or the physical therapist, depending on what the athlete is telling them. I heard a pop, or it's
Right.
not that bad, or the swelling started instantly, or all these different details we'll never hear.
Hmm.
Um, so I would say they're pretty good guesses for the most part. But one of the other little tricks you can use before you know if it's grade 1, 2, or 3 is when they start giving timetables.
Oh,
So if
okay.
they say like a 10-day IL stint is possible,
Right.
probably a grade 1. Because if they're even considering less than 10 days, there's no way that's a grade 2 strain. If
Okay.
they see that imaging and they say 4 to 6 weeks. That's kind of the classic, like, grade 2. We'll put it in that little category. And usually when they don't give you a timeline, then you're starting to be like, "Oh, is it grade 3?" Because they're worried to say he's out for months or what's going on. So then you
Yeah.
just kinda have to wait those out.
What part of the body or what parts of the body are you most concerned about when you hear that these have been injured for baseball players? I know when you're talking about pitchers, we're talking about shoulders, obviously, but
Mhm.
are there any kind of other big, red flag parts of the body where you're like, oh, that got hit? I am really concerned about power being sapped or whatever the case may be.
Yeah, there's definitely a few. If you have, a player who relies on speed,
Hmm.
repetitive strains of hamstring or calf is a really
Okay.
big one. Like,
Okay.
pretend Josh Donaldson is a guy who relies on speed. He's injured that same calf like
Sure.
5 or 6 times, that same hamstring. That's someone who you're like. Ketel Marte is a good example of someone who
Yep.
used to be a speed guy, and he's kind of turned into a different player now.
Sure.
Despite the rest of his team running wild, he's kind of just staying at first base comfortably. So repetitive strains of the same muscle group for someone who's relying on their quick twitch is a little bit scary because you start to see their game start to change and how they approach it. If you're talking purely about the swing, I never like to see oblique injuries. We're seeing Seiya Suzuki come back nicely from one,
Hmm.
but you've also seen a few guys just totally fall off the table. Like last year, I think Franmil Reyes
Yep.
had a bad one, and he really hasn't bounced back since. Um, Obliques are basically a diagonally oriented muscle in your abdomen,
Okay.
and it's not the muscle that you would see on like a six pack. It's one of the deeper muscles that
Okay.
is responsible for rotation. So that's one that usually makes me a little nervous for hitters. So that's another
So
one.
I don't know if you saw my physical reaction when you said the word oblique because
Hmm.
I literally I'm so glad you said that because I don't think I've ever used an oblique muscle. I guess I have now, but I didn't know even I had one. And I hear it constantly being used. So
Hmm.
anytime I'm using my trunk, I'm sorry, my trunk or my torso, right, to
Yep.
just turn at all, I'm engaging my obliques at that point.
Yes, you are. Yeah. And
Okay.
you'll also partially engage them with things like coughing, sneezing, laughing. That is not the primary muscle being used, but it's there
Okay.
for support. It's making sure you don't bend forward. It's making sure you don't topple each way. It's keeping you fixed over your spine. Um, so the issue with hitters is you engage those muscles extremely rapidly as you go to start rotating forward.
Sure.
So let's say you are expecting fastball and you get
Mm,
a slider low and away. You
sure.
start your swing and you kind of stop and then start up again. That's the oblique going fire, relax. And that's a lot of times when people are going to injure it. So that gets a little scary for someone, especially who's chasing a lot of pitches.
Okay. Well, I will always be nice to my obliques now that I have some idea of what they're doing.
Hmm.
But the idea of straining that and hurting when you laugh, cough, sneeze, bend
Oh yeah,
over, turn, that sounds kind of important.
it's
So
when
for
yeah,
for even non-athletes.
when you hurt your oblique, you know exactly what it does because almost every part of your day is like, oh, didn't know I used it for that. Didn't know I used it for that.
No,
And
that's
they're
horrible.
constantly being used. So that's. I mean, they get better. It's not one of those injuries where you see like, oh, career's over, but it certainly takes a while. And for example, someone like Reyes, it just didn't get his timing back. And if you're someone's kind of on the brink of being in the majors, that could be a real big uh, speed bump. And then to take that question into pitchers, anytime you hear labrum, that's scary.
Okay.
Um, Muscle strains you can come back from. Tommy John, we've seen people do fine with. Ulnar neuritis is another scary one that sometimes leads to Tommy John, but again, you come back from it. There's a lot of studies that are done on labrum injuries for pitchers that suggest that it's not quite a great percentage of people come back to their peak level. And it might be someone coming back having a dip a couple miles an hour, change their
Mm,
game a little, but that one is a really it makes you hesitant. Like, oh, what's this guy's long term value look like? And if
Well,
it's okay with you, I don't know, do you want a little bit further of an explanation of what the labrum actually is?
I was going to ask you that exact question.
Alright,
I'm glad
perfect.
you're good. Yes, it's absolutely okay with me. I am here to learn.
Perfect. So, we basically can kind of narrow down the labrum's job to it is essentially an extender for the ball and socket joint of your shoulder. So,
Okay.
if you can imagine this, the socket is much smaller than the ball. So,
Okay.
you've got a really, really mobile joint that's basically held together with muscles, tendons, ligaments, and unless you're strong and coordinated, that shoulder is has a possibility of subluxing and dislocating. So the labrum is designed to make the the socket of the joint even deeper. It kind of
Mm,
sits on the rim of the entire socket and cups the ball a little bit more.
okay.
So if you injure your labrum, usually it is because your rotator cuff or some of the supporting ligaments are overworked and it starts to put strain on the joint itself, on the
Mhm.
labrum, and it's a snowball effect where this isn't working, so that has to work harder, so that gets hurt, so that starts working harder, and it doesn't get great blood flow. So when you hurt
Oh,
it, it heals very slowly, and oftentimes requires surgery to just remove a piece. So it's a scary one.
wow. Okay. I'm sorry. I'm writing down some of these key terms that I need to now look at all my rosters to make sure I don't have anybody with these issues. Wow.
Yeah.
Okay. So then, which one of these, or I guess not which one, but if there's a group, do you think is the easiest to re-aggravate? If because you see a lot of times where, especially like Bryce Harper, right? It seems like every
Mhm.
day his timetable moves up a month.
Right.
But which injuries are you most concerned about somebody rushing back from, or the timetable being shortened because they're healing so quickly?
Well, a lot of times when people get rushed back, I first look to the context of where how the team is doing. Is it a playoff race?
Right,
Are they on the verge of maybe being knocked out of the playoffs? Is it September or late August?
right.
Those are the times when you see, oh, are they rushing this guy back just to make a run? I don't get as worried about that this early in the year, especially if it's a team that is either comfortably very good or comfortably very bad. They probably have a decent idea of what their season's going to look like, so there's no need to rush. Um, Bryce Harper is a great example of that. I'm not particularly worried at all about them rushing him, and that's actually someone I had highlighted back before the season on one of the Dynasty One Stop pods. Is there's a good chance Bryce Harper is going to come back early, just
Hmm,
because of the way, and I'll get into this in a second, but
sure.
how he swings and which elbow it is really changes the stress that goes into that UCL. Um, but to answer your question, the one that I'm most worried about is those repetitive muscle strains that when the player keeps rushing back, they're probably feeling good in rehab, and then they get to that game speed and the minor league rehab stint, and they go, "Oh, setback, he's back on the IL, back to minor leagues," and it's a cycle. So like a second calf strain of the same season or hamstring strain, that's or oblique, that's the one I worry about a lot.
Okay. So, all right. So then, with some of these, I have another one injury that I'm not really quite sure what it is, or maybe you can explain it to me. But so, what is a teres major
Major,
muscle
yeah.
strain? Okay, muscle strain. And are they contagious? Since Triston McKenzie now has one, and Cody Morris from the Cleveland Guardians. And what kind of recovery timeline are we looking at here?
So the teres major is
Okay.
interestingly enough will often show up on fancy restaurant menus because it's a really prime cut of a cow. Fun
Okay.
fact that I
I was
learned
hoping you were
last
going to
year.
say Cal. Okay. I was like, what kind of restaurant are you going to?
No, I just learned that recently when I saw a menu for a wedding, and I
Oh,
was like, "Oh, PT nerd talking about anatomy class. That's teres major. That's a muscle that we have."
okay.
So no, a teres major is it's located kind of where the scapula meets the rib cage,
All right.
and it coordinates with the upper part of the arm. So it actually essentially works the same exact way as your lat muscle, the latissimus
Okay.
dorsi, that I think people are a little bit more familiar with. And that goes from, again, the very top of your arm near the shoulder joint and goes all the way down to the lower back. Now, the teres major doesn't go quite that far down, but it basically works to bring your arm closer to your side, extend it behind you, and internally rotate it. If you're trying to imagine what internally rotating is, if you have your arm down by your side and you turn it to face your palm behind you, where your thumb is put closer to your body,
Okay.
that's internal rotation. So, as it relates to pitching, oftentimes the lat or the teres major will get injured when either the rotator cuff is overloaded with a new pitch, a new delivery, change in mechanics, ramping up too fast. So I can't 100% attribute it to rotator cuff dysfunction or anything else.
Mhm.
Um, but it's not one of the primary muscles that power the ball forward. So
Oh,
it's
okay.
not quite as worrying to me as a rotator cuff strain. It's one of those accessory muscles that helps kind of guide the arm in the right plane. So to answer why or how long these take is it really comes down to that grade of the injury as well. So
Right.
you got the grade 1, 2, and 3. Off the top of my head, I can't remember the grades. I think they were both grade 2s for those guys. Um,
Let's
but
say
that
they
was,
were.
let's say
Let's
they
say they were.
were.
Yeah. Let's say they're great too.
If it was grade 1, they probably would have already been back. So it's probably
Right.
grade 2.
Okay.
And that's where you start looking at the initial timeline is 4 to 6, 5 to 7 weeks. You start them on a throwing program around 3 to 4 weeks, see how they do. If there's any pain still, you wait, and basically you're just waiting for this 4 to 5 week ramp up to start whenever they feel good.
Okay.
So they're going to their trainers every single day. They're getting cupping for blood flow, uh, different types of stimulation for blood flow, electronically or electrically and otherwise. They're getting massages. They're getting all this compression therapy. So they're probably putting in 5 or 6 hour days just rehabbing, and that's how you get back quicker than the rest of us when you have all that at your fingertips.
Yeah, because I'm glad you brought that up because a lot of people think rehabbing is just you go there, you do some stretches on a ball, or you have somebody like yourself standing behind them and maybe pulling the arm one way or another, and they're done for the day, and they're have their feet up or whatever, eating their whatever foods that they're supposed to be having for their diets. Maybe can you just go a little bit more into just how strenuous we're talking about here? Because rehabbing is an absolute, job in itself, in the sense of the player. I mean, obviously, it's your job as well, but
Yeah.
what I mean is, the player has to be completely bought into this. I mean,
hmm
can you please talk about kind of the strenuousness of what we're talking about here when it comes to rehab?
Yeah, I think one of the rehabs that people kind of relate to the most visually or otherwise is an ACL. So that's a
Mm,
good example to kind of go with. You see a lot of the football players or whoever posting their rehab videos um, for about 9 months straight. And if you're a pro athlete, this is every day, give or take a couple holidays. If you're not drenched in sweat 1 hour into your rehab, it's usually not being done right, or at least not to the level that a pro athlete needs. So they're coming in as early as anybody else on the team, maybe earlier if they want to be on the bench for the game. They are warming up with pretty intense exercise, even if they're at the point where they're bedridden or table ridden and they can't weight bear, they're flexing their muscles until they can't anymore. You're doing massage for probably 30 minutes to 45 minutes. You're getting, like I said, the electric stim or cupping or compression therapy. You're back on your feet doing the exercises again. And it's pretty much a straight up sprint all the way through to try to get that muscle back to where it is or get that ligament back to bearing as much weight as possible. Um, and that's why a lot of players have turned to having their own personal physical therapist with them throughout the year. And I've talked to a few guys in the big leagues about the possibility of doing that and what it would entail. And it wasn't something that worked out for me scheduling wise, but a lot of players do that. And they also will, I have a few friends who do this. They will have a guy in New York City, they'll have a guy in LA, they'll have a guy in Denver, Chicago. And anytime they're close by, they'll say, "Hey, I'm flying you out. I have a 5-game series and my back is hurt. Let's go." Um, these guys are putting in 10, 12-hour days, even if they're playing through an injury. We don't even hear about those.
Right.
So the rigors of what they're going through is something that it's hard to fathom because we've probably never moved fast enough to hurt ourselves that bad.
Right.
And then we don't have to get back to moving that fast again. So it's hard to be like, yeah, I rolled my ankle. What's the big deal? It's like, no, it's not. It's not like that.
So now that we've kind of moved from soft tissue, I want to talk about fractures for a second. So I'm confused. Adam Duvall, avoids surgery, or they say that he avoided surgery on his fractured left wrist. Yet other people opt for surgery, and I'm not sure which one I should, for lack of a better term here, which one I should want my player to want.
Hmm.
Which one should they opt for? Why will it hinder Duvall? If he decides to go the healing route, and obviously all the things that go with it, or should he have gotten the surgery from? Again, I'm not saying that he should or shouldn't medically, right? Not your opinion, but from a fantasy perspective, which one should I expect? I guess a better healing process would be the best thing to look at.
Yeah, I think as a fantasy manager and just even a casual fan, you're always rooting for the non-surgical route
Okay.
because 9 times out of 10 it means that the fracture was cleaner.
Okay.
And by that I mean if you, let's say you drop a glass on the ground and it just cracks and there's a line down it, but it's still intact. Uh, that's going to be the type of fracture where everything is still in place, where they say, "All right, let's go non-surgical." Your bone will heal itself. It will start to build connections and solidify. Sometimes it even ends up being stronger than what it was before. If they get cleared for a non-surgical recovery, that means it is a much easier fracture to deal with. So you're almost always rooting for that. The only option I can think that might not be as optimistic is if, again, if it's a team like in a playoff run and they're like, "I don't really care what this does to you in 3 years. We need you now." That's the only, and so by that point, you can only speculate.
Right.
So, and it's also playoffs where most fantasy leagues are done. So it doesn't really affect you that much. So I would say like 9.9 times out of 10, you're hoping for the non-surgical option because that means
Okay.
they were cleared to do it without the surgery. So if they do have the surgical recovery, good chance it's going to work because they are going in there and solidifying that surgery with either they're even doing it with pretty intense glue now, or rods or pins or whatever it is. Um, so long term, there's not really much to worry about unless you hear of complications or like Alex Smith's fracture of the Washington, I
Right.
think it was football team at the time, or I don't know what their logo
One
was.
of those. Right.
One of the Washington logos. That's a fracture where you hear a lot of details about infection and difficulty getting it back to being solidified, and those are very rare. So
Okay.
I, that's the one scenario where if you start hearing about the surgery failed or there's infection, that could take a while. But fractures as a whole, I don't really worry about long term because, like I said, your bone's going to come back. It's going to be potentially stronger than it was before. And other than building up your speed and your hand-eye coordination and getting yourself warmed up again, shouldn't have a long-term effect on almost anything.
Okay. So our final kind of question here comes from one of our VIP members of our subscribers for our fantasy6pack.net. When you become a subscriber, you can send in questions and we'll ask them of our experts. So this one's about Oneil Cruz. To sum up what he's basically saying is, we all saw the collision at home plate, and he's been diagnosed with a fractured left ankle on April 10th. The member wants to know, is he safe to drop Cruz um, if he doesn't have an IL slot, or do you expect Cruz to come back at some point this season with that type of injury?
I do expect him back.
Okay.
and I wouldn't be shocked if it's only for a couple weeks. Like, my first
Oh,
thought
really?
when this happened was, think about last year. He came up in, like, I think September or maybe really late August, and he was
Okay.
awesome. He was electrifying, and it was really cool to have him on your roster, but I don't think it's going to be for very long. So if you are someone who's pretty confident in your team and you're like, I'm going to be in the playoff race and I could use that push at the end, I'm pretty confident he's going to come back and just continue to light it on fire.
Oh,
He'll
wow.
probably still strike out a lot, but other than that, he's going to be giving you all the type of stats you want. So if it was my team, I'd have a really hard time dropping him. But on the other hand, if you're somebody who is continually saying, like, I could have picked up this guy if I had that one other spot,
Right.
I'm starting to fall in the standings, it might be a decent play to drop him and then try to pick him up again in like July when
Right.
hopefully no one else is thinking about him. And then you only have to deal with
Right.
that dead spot for a month. Um, but the best advice I can give you is, if and when he comes back this season, which I think he will, it shouldn't really affect his play.
Okay.
He should be back to 100%.
Well, that's all the questions I got for you this round. If we're allowed back, I'm going to have a ton more. Thank you so much, Nick, for joining me on this. Do you have anything to plug? Do you have anything? Where could people see you, reach you, other than, of course, your daytime job?
Yeah. Yeah. I'm plenty busy at the daytime job, but I'm sure we can find some spots. But no, on Twitter, you can reach me at Nicociva1. That's Nicociva and the number one. Just joined up with the Dynasty One Stop podcast group, and we're doing some more MLB injury insight. You can find that on all the popular podcast apps and whatever you got. So for that, we're usually doing once a week, 8 to 20 minutes or so of who got injured this week, what you can expect, roster decisions, and then again updates on guys like Harper or someone who's coming
Sure.
back soon. Um, so that's probably the primary way. Feel free to reach out to me on Twitter if you have any specific questions about injuries, what to expect, and we try to do our best.
Well, Nick, you've always been incredibly approachable. I think I reached out to you about a year ago to fact check one of my articles that I was writing back then, and you've just been amazing all this while. And I cannot thank you enough. I finally get to see you face to face, so this has been great for me as well. Thanks everybody for listening, watching us. Please drop a comment, drop a question. Nick and I will be happy to answer it, or hey, maybe we'll make you part of the next show if we have one. But thank you so much for spending some time with us, and we look to hope and to see you soon.